Hello, my name is Mike Willett with the Intertribal Council of Michigan. Welcome to our webinar series, the Tribal Vaccine Equity Project. This webinar series aims to provide American Indian and Alaska Native communities with culturally tailored training, resources, education, and technical assistance to build vaccine confidence, increase vaccine access, and mitigate the disproportionate burden of adverse outcomes through vaccinations. This webinar is titled VacciNative Vaccination Information for Natives by Natives. This technical assistance webinar is being hosted by the Intertribal Council of Michigan, which offers technical assistance and resources around tribal vaccine equity throughout Indian country and the Indian Health Service Clinical Support Center. Your presenters today are Dr. Lakota Scott, VacciNative Program Manager from the Northwest Portland Area Indian Health Board, and Tam Lutz, Vaccine Programs Director, Northwest Portland Area Indian Health Board. We are pleased to offer continuing education credits for participants in this webinar. There is no commercial interest support used to fund this activity. This activity is designated one contact hour for nurses and physicians. And to obtain a certificate of continuing education, you must be registered for the course, participate in the webinar in its entirety, and submit a completed post-webinar survey. Webinar surveys will be emailed out to everybody within 24 hours after today's event. At the conclusion of this activity, the healthcare team will be able to identify areas where vaccine confidence is lacking, for example, hesitancy of COVID-19 vaccines, utilize resources for natives by natives to increase vaccine confidence with staff, patients, and community members, and examine the Northwest Portland Area Indian Health Board's collaboration with other TECs across the country to identify potential collaboration opportunities. If you have any questions, please type your questions into the question box on your Zoom panel. Questions will be answered during the last few minutes of the webinar. And now at this time, I present to you Tam Lutz.
Now I'm going to turn my mute off. Thank you. Haishka, Siam. Oops, I'm trying to, if you can go to next slide, Mike. Just wanted to introduce ourselves a little bit more. Naut Siam, Nachalacha Siam, Tam Sanat Snat Siam, Chad Tam Wixen Chaklamitsan. My name is Tam Lutz. I greeted you in my native language, Klami Chasen, the language of the Lummi Nation. Just saying hello, Ait Squal, good afternoon. I'm Tam from the Lummi Nation. I have been working at the Northwest Portland Area Indian Health Board for nearly 24 years next month. And mainly in maternal child health programs, including our two vaccine-related projects at the health board. And I'll hand it off to my colleague, Dr. Lakota Scott.
Yeah, أنا شك أيدا شدتنا أشي Lakota Scott ينشه أشي هنشلت ودش إيني بشش جين أزلنا أيدا شد نالا دا دشش شيء تطلق أيدا زهده يسي دات ناشك أدي Portland دشغن. Good morning, everybody. I am Dina. I'm originally from White Mesa, Arizona, and currently reside in Portland. And I also work for the Northwest Portland Area Indian Health Board. And I'm a naturopathic doctor, and I am working across two our vaccine programs, the VacciNative program, and then also the Native Boost program.
Great, thank you. Next slide, please. I know there are too many of us online right now for us to all introduce ourselves, but if you could take the time to put in your, take a moment to put your name and your tribal affiliation or tribal community that you represent or your role in that community, that would be appreciated so we can see who's here today. Okay. All right, thank you. So during this presentation today, we're going to discuss a bit about why some people are hesitant to get vaccinated. And we'll also be asking you questions throughout to answer and share throughout the chat about what you're experiencing in your communities. We'll also talk about vaccine confidence and how to increase vaccine confidence among your friends, family, acquaintances, patients that you serve. We'll share some conversational tips that you can use while talking with others about vaccines. And then also we're going to highlight some of the sources of information that we have used, that we have put together through the two programs that both Dr. Lakota Scott and I have worked on. Lakota?
Thank you. So before we discuss vaccine confidence and how to build it, let's briefly talk about vaccine hesitancy. Go ahead and go to the next slide, please. And so if we can, in the chat, or you can go ahead and answer these questions that we have. So what have you been hearing about vaccines in your area? And then go ahead and go to the next slide, please. And what are some reasons that people in your community might be hesitant to get vaccinated? And so we know that not everyone is confident in vaccines. And so we just want to know more about what you have heard in your community concerning vaccines. And thank you all. I hope that everybody is able to add some information so we can kind of get an idea of what the different communities are facing in terms of vaccine hesitancy around the country and in the area that you're currently located. So some of the communities that we've talked to, you can go to the reasons for vaccine hesitancy slide. Some of the reasons for vaccine hesitancy are misinformation obtained from online platforms like social media, or sometimes it can be even pressure from family, or we can have fear of needles for some individuals, or just an overall concern about vaccine safety, such as the ingredients within vaccines. Next slide. Next slide, please.
Let's try to.
Oh, sorry.
There we go.
Oh, it's still not going.
I don't know, Mike, if you can forward it. Mike, are you able to forward it? Because it's not working. Mike, can you hear me?
Yep,
Mike?
I can hear you.
Oh, I can't. It's not working for me to forward it.
Oh, one moment here. Let's see.
Great, thank you.
There we go.
So also we know that Indigenous communities have resisted colonization, boarding schools, forced sterilization, and medical racism. And due to this history, there is a mistrust with the federal government and medical care, including vaccines and those who distribute them, like pharmaceutical companies. And so this is something that's important for us to acknowledge in our conversation with others. Next slide. So now that we've talked about some of the reasons why people are hesitant to vaccines, let's discuss what exactly vaccine confidence is. Next slide. So vaccine confidence is the trust that people have in recommended vaccines. And in addition to that, professionals who are administering the vaccines and processes and policies that are leading to the vaccine development, the licensure, the manufacture, and the recommended use of the vaccines. And so in order to build vaccine confidence, we have to build confidence in the vaccines themselves and the professionals who are giving the vaccines and vaccine development. Next slide. So we understand the importance of vaccine confidence, but how can we build vaccine confidence in those that we speak with? Next slide. To increase vaccine confidence in friends, family members, and acquaintances, we have to set the tone before we begin the conversation. So we can do this by asking open-ended questions to promote open conversation and listening to their concerns about vaccination. So when we ask open-ended questions, we're not inputting our own response of what we think vaccines should be taken as. And we also are listening rather than speaking over somebody and really trying to understand where they're coming from and letting people explain their point of view. Next slide. And when we listen to them, we're showing them empathy and understanding, and sharing your reasons for getting vaccinated can be helpful, especially if you're coming from the perspective of being a trusted person or even a peer or a professional. And next, we can ask permission to share information about vaccines, because if a person is not ready to receive information about vaccines, then they can become very defensive and it won't be very effective because they're not ready to receive that information. Next slide. If they're open to hearing more, we can address any misconceptions with facts, and then we can help them find the meaning in vaccination. So we can share accurate sources of information, such as the VacciNative and Native Boost campaigns. And finally, if they are ready, we can help them make a plan to get vaccinated. Next slide. Remember that when you're beginning conversations about vaccines, you're also helping to build a relationship with that individual or with the family. And so to be able to create an environment of respect and partnership, we also need to use positive body language. So making sure that we're not crossing our arms, rolling our eyes, or standing above them. So we want to make sure that we're speaking in a friendly, calm tone so the person doesn't feel intimidated or patronized, and try to be open to what they have to say. And lastly, we want to listen and do not interrupt them as they're saying what they want. And so we want to let the other person finish talking before we talk ourselves. And keep in mind that setting the tone is as important and maybe the first of several conversations to come up. Next slide. Open-ended questions are designed to get more than a yes or no answer. So when we ask open-ended questions, you are getting a sense of what the other person is worried about, where they learned about troubling information, and what sources they've used to get answers to their questions. Next slide. So we want to share reputable sources with them, like the VacciNative, Native Boost, or information from local health departments, healthcare providers, the Centers for Disease Control and Prevention, or the CDC, to be able to answer their questions about vaccination. Next slide. And so if you can put in the chat what open-ended questions you might ask to be able to understand someone's concerns about vaccines.
And
I
if you
do want to
can't,
jump in real quick. It looks like that the chat is disabled at the moment. We're trying to work on getting it going again. But
Okay.
I
yeah.
was just going to say that you can
Sorry about
you
that.
can put it in the Q&A function.
Yes,
Yeah.
please put it in the Q&A, please.
There we go.
Not in the chat. Thank you. We can go to the next slide. So when someone states their concerns or supports their stance with inaccurate information, we want to listen to them without judgment. So make sure that you're calm and open and ready to listen. And throughout your conversation, using that positive body language. So making sure that your arms are uncrossed, making sure that you're keeping eye contact or not doing things like rolling your eyes. And even if you disagree with them and their thoughts and their feelings because they're different than yours, we don't want to treat them with disrespect. So we want to respect the other person's thoughts and feelings. So we don't want to interrupt them, and we want to make sure we're letting that person finish talking. Next slide. And simply affirming someone's concerns and experiences can go a long way. So try to use phrases like, I can understand your concern, or it's understandable that you see things that way. So being able to validate the way that somebody is feeling can be really important in being able to come to common ground. Next slide. Make sure the other person feels heard by responding with empathy and understanding. So keeping in mind that you need to acknowledge the chaos of that person's life and what they're going through. For example, you can say that sounds very stressful. I'm sorry to hear that your vaccine concerns are causing you more stress. And we can think of this especially for parents that are bringing their child for child visits and possibly vaccine visits on top of that, where they have lots of things to be able to take care of, or even having to bring an older parent in for vaccines. There are lots of things in terms of scheduling that we have to be able to be understanding and acknowledge and empathize with the people that we're talking with. Next slide. So we don't want to tack on words like but. So for example, even if you disagree with someone with something that the person says, we don't want to say something like, I hear what you're saying, but I don't agree. This can put the other person you're speaking with on defense. And so we leave it at, I hear what you are saying. And so we want to be able to acknowledge and empathize without adding on. Next slide. So don't directly challenge something the other person says that you think is wrong. For example, don't respond by saying, no, that's not true. Instead, try saying, what I've learned from example of this trusted source, such as VacciNative, is, and you can share the factual information. So a trusted source can be a credible provider, it could be a health organization. And so we'll discuss some of those credible sources later on in this presentation. Next slide. So we have another question, and if you could put your answers in the Q&A. So what can you say to show someone empathy, even if you may not agree with what they are saying? I want to check to see if the Q&A is working. Oh, great, we have some comments. Good, next slide. Oh, next slide, Tim. Thank you.
Do you want to share maybe one or two of the comments? So one said, can you share with me your concerns over getting vaccinated? And then there was also a question about, or it sounds like you have some concerns. Can you tell me more about that? And then there was a question that said, just had an elder say that he never got the flu shot. I asked him why he didn't, asked him why he didn't answer, didn't push it as he is an elder. What would you have said? That's a question for you. What would you have said?
Yeah. So for a patient that doesn't want to share, I think I wouldn't push it for, depending on, it's kind of along the same point of kind of letting people talk and giving that space. So for some people, it could be they don't really know, or maybe they haven't pieced together exactly why they have never gotten a shot, or maybe it hasn't been offered, or maybe they haven't got to the point where they've been able to put together the words to be able to explain. So I feel like for people that don't answer, maybe they're just not ready to talk about it yet. And so it can put people on the defense if you keep pushing and trying to get people to answer like exactly why, because maybe they don't have an answer for that at that point. And so I think it would be a good idea to just to just let that go and not have them answer in that at that time in the visit.
And then we had a couple more good ideas. One that said, I would say, I hear your concern. This is what I have learned. And then provide what you have learned. Another saying, repeating their statement, and then saying you understand what they are saying. And then we have, I see you feel strongly about vaccines. Are there any questions that I can help you find answers to? Thank you. Those are all great examples.
Yes, thank you for all participating. So sharing your reasons for getting vaccinated with those you speak with lets them know that you're not asking something of them that you would not do yourself. So try using phrases like my family and I stay up to date on our vaccines, and we want to be protected from illness. We also want to do what we can to protect everyone in our community, including our elders. Next slide. So we can use phrases like, I get a lot of comfort knowing that this vaccine has been safely given to millions of people. Next slide. And because I'm vaccinated, I can safely spend time with my grandparents and participate in ceremonial practices. Next slide. And once you understand the other person's concerns, ask their permission to share information about vaccines. If they say no, respect their decision and let them know you will be there for them in the future if they want to discuss vaccines. If they say yes, you can share accurate sources of information. And later on the presentation, we'll list accurate sources of information you can share. Next slide. And so you can consider sharing these online resources where people can find additional vaccination facts. And then at the end of the presentation, we'll have QR codes that you can scan and to visit website URLs to access some of these resources. Next slide. And I'm going to hand it over to Tam.
Great. Thank you, Lakota. So as you have heard, Lakota has talked about addressing other person's concerns with empathy, respect, and also providing accurate information from reliable sources to help steer the conversation toward why they should consider getting vaccinated. So, for example, you can ask them, what positive things can you do when everyone is vaccinated and healthy? Allow them time to think and help them with their responses by possibly mentioning the things that you can do when you became vaccinated. For me, when I was talking to hesitant friends or family or coworkers, I would talk about my desire to get back to tribal canoe journeys and spending that time with family. Or spending time with our elders or participating in other cultural activities. Next slide. Okay. Some of the accurate sources of information that I'd like to share today are the two projects that Lakota and I have worked on, and they are intended to help individuals make informed decisions about getting vaccinated. And you can see our logos that are developed here for VacciNative and Native Boost. The one on the left with Native Boost was developed for the Portland area of Oregon, Washington, and Idaho tribes. We have 43 tribes in our area. Hence, our logo has our cedar hat, which is traditional to Coast Salish people. And then next slide. VacciNative is a national campaign that also offers accurate vaccine information for Native that has been developed for Native people by Native people. It's intended to help American Indian and Alaska Native adults weigh important vaccine decisions. Staff from Tribal Epicenters, trusted elders, Native health professionals worked together to develop VacciNative through a national campaign that offers accurate vaccine information for Native people by Native people. Next slide. Okay. VacciNative was designed to support health providers and health educators in having vital conversations with American Indian and Alaska Native clients. Next slide. What I think is really important about this campaign and what makes it a trusted resource is the process that we use to develop these culturally and resonant materials through VacciNative. We spent a lot of time gathering information from trusted elders, from national health, Native health professionals nationally, as well as other experts working within tribal communities and tribal epicenters. Next slide. And if you were to go to our VacciNative website, which is found on the Indian Country Echo website, and we have a link to that later on in the presentation, you'll see a number of the people who have participated in on our VacciNative Alliance work group, representing the tribal epicenter areas nationally. Next slide. So each time we would meet together, we would review information that was collected, we'd share anecdotal information, we'd review materials, and we'd make sure that we always vetted it with the VacciNative Alliance, and we'd often get additional sources to be featured in our VacciNative materials. So folks from different areas, we try to make sure that this is not just these are not just products coming out of the Northwest, but it's truly reflective of a national audience. Next slide. Okay. Here you can see our VacciNative website. Our VacciNative page, which again is found on the Indian Country Echo.org. And on that site, you can find handouts that have been developed. And we'll go over those in more detail. We have video PSAs that are developed, and we're actually working on some radio PSAs as well. We have provider presentations, just like this one, that provide all the text to your presentation. You can customize it however you want. You can put your own logos on it, edit the slides. We ask that just reference at the end that this has been in collaboration with the VacciNative Alliance. But those are free to, able for anyone to download and use as they will. And then we also have some social media toolkits. And next slide. Okay. These are just an example of some of the handouts that have been developed. I think we have about 10 of them now. We're on an ongoing basis, adding new topics as they come out through the VacciNative Alliance. So, for example, here are some of them here about overcoming vaccine fears and learning about vaccine ingredients and vaccine safety. Some of our newest fact sheets have been around respiratory illnesses. So you'll see vaccine handouts up there around flu and RSV, long COVID. We're in the process of developing additional ones geared towards elders or those who are caring for elders. As well as one around monkeypox and I am just blanking out on the other ones that we had, Lakota, that we were just talking about yesterday. Oh, but so it's constantly in development. The VacciNative Alliance members can bring forward additional topics, and then within our coordinating center and our consulting team, then we work on producing those handouts and bringing them back. And as you can see, we feature real people and photographs of them to be featured in these handouts. We spent a lot of time also vetting with the VacciNative Alliance the type of graphics and colors and imagery that folks wanted to see, and different depicting different images from the different regions. Next slide. We also have video PSAs. One particular topic that was mentioned through the Alliance that some individuals were hesitant about vaccines because they felt it was in contrast to their wanting to live more traditional lives, kind of folks that were participating maybe in a food sovereignty movement, and that how does that how can that interact? And so we have a great video PSA with Dr. Scott talking about how traditional plant medicine, naturopathic medicine, and allopathic medicine can be woven together for optimal health. And then we had a tribal elder who talked about her own experience with food sovereignty and living a traditional life, and her hopes for people to be able to use, take advantage of vaccines so that individuals can flourish and enjoy those traditional practices that they feel are important to their lives. And I think we had some questions. Let me see.
No questions. There was just one comment.
Oh, one comment.
It says, I like that VacciNative allowed use of their native designs. I use the pictures to create flyers to encourage vaccines with their logo. Not a lot of designs are available in that way. So thank you.
Oh, good. Okay, next slide. And if you go to that website, you can download those videos and use them. And you can also download any of the presentations as we talked about earlier. So here's just a couple of examples: protecting yourself, your family, and your community from flu. And when one is not enough, one of the other themes that we heard was people thinking that either the flu or the COVID shot, because with COVID having a booster, that the vaccine, that we didn't take time, and that the vaccine wasn't good enough and it wasn't working. And so we created a presentation about understanding the difference between series and boosters. And we also have a video PSA that includes that as well. So sometimes these elements, the handouts, the video, and the presentation all work in unison for the particular campaign subject that we're trying to address. So you'll find those in there. You can use them, slap your own photographs in there if you like. And next slide. And we also have social media toolkits. I think we're updating those too, because some of the elements of them are, for example, in the two middle images with the button blankets and the cedar hat, the imagery is very specific to the Northwest. So we're working with our graphic artists to also have that available so that you can put your own images in there as well, if those images are not suitable for your region. But we do try to make imagery that does show the different regions, and then we also have some that are combined together, or some that should be able to be used regardless of the region that you live in. It provides both the imagery, and it also provides the text as well for the posts, the social media posts.
Related to this, Tam, there's one question.
Sure.
How to navigate the spread of misinformation on social media?
The question is what again?
How to navigate the spread of misinformation on social media?
We do talk about that a little bit, and I have some tips here, so I will get to that. Next slide. We also have that I mentioned earlier was the Native Boost project, and this project really focuses on childhood immunizations, and it can be found at mphb.org, Native Boost. Next slide. At this site, we've had a kind of a different focus every year. In our first year of the project, we really focused on building provider confidence and communication. We've provided medical provider guides, parent guides for them to be able to provide to their community if they were having community listening sessions about vaccines, or gatherings, or even working one-on-one with a parent. We've also created a tabletop guide to either put in the clinic waiting room, or to have in exam rooms, to have something to be talking with or referring to. Next slide. Oh, and I should have said too that the parent guides cover things like vaccine safety, talking about vaccine ingredients, vaccine schedules, and comforting your child when having a vaccine administered. And the medical providers guide is more about why parents are hesitant, providing conversation tips, and then addressing specific issues around vaccines. Okay. We also have vaccine RAC cards that are available as well, such as HPV RAC cards that provide information on cancer prevention with HPV vaccination, recommending ages for administration, side effects, and frequently asked questions. We have video PSAs that are specific. If you could go back one slide. Sorry about that. In the video PSAs, we have a number of themes. One was just trying to help people think about other ways in which we provide and protect our children. And so we use sports as an analogy, talking about, we use helmets and shin guards and, equipment to protect our children participating in sports. And that vaccines is one other way that we can provide and protect our children so they can enjoy playing and participating in the activities that they enjoy. And then we also have another PSA that talks about an intergenerational household and how we protect our children to also protect our elders. Next slide. And then we have this a wonderful tool that's available through some educational videos featuring Dr. Scott, who is talking in small 3 to 4 minute video clips, educational video clips about the different types of vaccines. So mRNA, inactivated, attenuated, vector, subunit, and toxoid vaccines, and also talks about community immunity. with some really nice kind of animated graphics in there as well. Next slide. We also, in a subsequent year, created a peer advocate training. And in the peer advocate training, we all have family members or friends or coworkers that maybe are on the fence about vaccines. And we desire not to push people away or antagonize people. And we want to find ways to talk to those close friends and family members. So we created some activities and some training materials around helping individuals learn about communicating, practice those skills, and work together. And we have piloted this so far, and it was very well received. And people seem to really have fun with it and feel like they, I was trying to remember our time frame for that, Lakota.
It was 1 hour.
1 hour. And when people came away from the training, they actually wanted to spend more time together. So we felt that was a really good evaluation note out of that particular training. Next slide. And then the last focus that we've provided in Native Boost was in response to educators and staff from our early childhood education and schools who were saying, you know, we keep having these vaccine-related events. We're grateful that our clinical staff come directly to our facilities to provide screening days or vaccine clinics in our facilities. But then once they leave, questions are still maybe present about vaccines. And we want to be able to answer those questions for our population and refer them back to, of course, to our tribal health facilities. But sometimes it's those people who are working directly with families, the staff at a Head Start or a teacher in a school, the secretary at the school who can be good advocates for vaccines. And how can we support those individuals who may be the person in closest contact to parents after those vaccines events are over. And so again, we featured Dr. Scott in this training, education and education staff support. We provided both presentations geared toward more like both at our Head Starts, we have, like at my tribe, we have an event called ISNAT, which is a good night where we have parent, teacher, student interactions in the evening. They have short periods of time in which specific public health topics can be addressed. And so we geared it towards something like that, as well as both for the parent to receive information, but also for the student or the preschooler to have an experience where they're learning about vaccines or learning about keeping themselves safe or preventing the spread of disease. And so there are individual lesson plans for the different age groups that are provided, and little packs. Lakota, for example, is showing how a vaccine works using a little wiffle ball, some shoestring, and some little Nerf darts that she shows. So they're kind of fun, very tactile activities, and also integrates the use of the videos that we have created. There's also a preschool focused book called Body Germs and Vaccines. So there's a couple different things. I don't know if you wanted to add anything more to that, Lakota. So a parent's guide to vaccines, hand washing, for healthy families and why vaccines are important are additional handouts that accompany this. And then there's parent night activities and classroom lesson plans geared to about 20-minute activities. Okay.
Yeah, so the lesson plans for the kids really focuses on teaching about hand washing and the germs. So starting with reading the book and then going over the steps of washing our hands, and even like putting powder on their hands to be able to see effectively how they should be washing their hands, and then putting those hand washing steps in order. So it's very interactive for the kids to be able to learn about it. And then the older kids is really focusing middle school, high school on the different types of vaccines. And then the elementary is going over community immunity, using bubble boards as an example of the way that infection can spread and the way that vaccines can protect communities.
Great, thank you. And the next slide. And then lastly, we have some social media toolkits. And we had a request to consider doing things with animals, because a lot of us have animal stories or traditions in our culture. And so we tried to pick some animals that we felt would fit the many regions of the Northwest, with some fun little sayings. Folks really like these so much at the tribal clinic level that they asked us to make little stickers as well from these little characters. So you'll see one that says hop to it and get vaccinated for school, or what was it? Don't be afraid of a little poke. Get up to date with your vaccines, or Scoden, let's get vaxxed. So just little animal things that were attractive to a younger age group. And then some of the providers have also asked to have these put into posters as well, but we haven't done that yet. One thing we have been really careful and thoughtful about is using materials that can be wiped down. So it's cost us a little more to do some of the rack cards, brochures, and posters to make sure that we had those type of materials that can also be cleaned and sanitized. Other accurate sources of next slide, sorry. Other accurate sources of information other can use to help them make informed decisions about getting vaccinated are our local and tribal health departments. We have a number of health programs in our area that have done amazing jobs with their social media or other print materials. Healthcare providers, doctors, nurses, pharmacists, Indian Health Service. And of course, there are also a number of materials that are found on the the CDC vaccine resource hub that's available. Next slide. And answering the question earlier, when folks are referring to information that you have some suspicions about, I think talking to folks about being mindful when looking at information or sharing information that they read online. And some of the things that we talk about are, best sources are sources that are current, that have indication that they have been updated regularly, that indicate that they've been reviewed by a medical professional and are based on fact or by scientific research. Next slide. It's also important that when looking at information online, that the authors are listed or the organization is listed along with credentials, and that authors say where their information comes from. And that's one of the reasons we were really wanting to show quotations and information on people that were identifiable as people from tribal communities, whether they were physicians, elders, young adults, vaccine professionals, in our materials. Next slide. And then when somebody does look at this information, and they're thinking about, someone decides why they should get vaccinated, they've reviewed information, offer to help them to make a plan. And depending on your capacity or what role you lead, this may include helping them make their vaccination appointment. If it's a friend or family member, going with them to an appointment or getting vaccinated together, or if it's a child, if they have children with them, holding their child where they're receiving their own vaccine. And next slide. Maybe we can pause there. Does anyone have any questions about what we've discussed so far?
So if anybody has any questions, feel free to type them into the Q&A box. Also, we do want to apologize once again for the chat problems today. That's the first time we've ever run into that issue, so we'll make sure to get that fixed for our next presentation. But if anybody has any questions, feel free to type them into the chat box, and we'll ask them aloud for everybody to hear.
And we did have one person who said some people think the COVID vaccine will make them sick. And I think, I'm trying to remember, in our materials, I think it's in the basic handout we taught, and in the flu handout as well, we talk about the difference between side effects as opposed to the vaccine making them sick, and weighing that to experiencing the actual disease, and that diseases may have short-term and long-term impacts. If you want to go to the next two slides, down to one more slide. So here's some of the sources that we talked about: the Tribal Epicenters, the Indian Health Service, and CDC. And one more slide. And here's our QR codes to both the VacciNative Alliance and the Native Boost Project. If you want to, I'm actually working with an update on the Native Boost website today with our webmaster. So there might be some changes to that particular site. But the VacciNative one, both of these websites will continue to grow with additional materials on them. And if you ever have something that you're looking for, or you have a topic area that you'd really like us to cover, don't be afraid to drop us a line. We're always looking for more ideas.
And just answering one of the questions. So the question is, the materials for the children, especially with animals, look super engaging. Are these available online, please?
Yes, if those particular animal ones are not on there now, they will be on there shortly. We've had some changes to the Native Boost website. And so we're working with our webmaster. We actually have a meeting with them today to make sure they have all our updated materials. And the health board is actually creating, it should be done by the end of January, are creating a health resource site so that individuals can, or programs can go on there and order things direct to print. So we've had so much demand that folks can actually go to that website and be able to order materials. So we don't have to package things individually and send them off, but it'll come direct from our printer.
I wanted to add in also, we did have a quick question about whether or not this webinar will be archived. And Hannah did drop in the chat that a recording of the webinar will be available and provided a link. We'll make sure to have that archive up by the end of the week. So by end of business on Friday, we'll have the webinar archive up on the website at that location at keepitsacred.org. And I don't see too many other questions in the question box, folks. With that, I think we're getting towards the top of the hour. Did you have anything else you wanted to add, Dr. Scott or Tam?
No, just appreciate being invited. And if there are other venues in which you would like us to share information, we appreciate any suggestions or invitations. And just again, can't say enough, just use what we have and don't worry about personalizing it. That's what we hope people do. So use our presentations or materials however it best suits the communities that you serve.
Well, thank you very much. Well, on that note, again, keep in mind, folks, that if you are looking for continuing education credits for this webinar, there will be a post-webinar evaluation that will be sent out within 24 hours. So keep an eye on that. It should come from Zoom. So keep an eye for a Zoom link, even check your spam folder. And you'll be able to get into the evaluation. And then at the completion of the evaluation, you'll be able to get your certificate that way. Also, please visit our website at keepitsacred.org, and you can find more technical assistance webinars, other archives, and other information. And again, the archive of this webinar will be posted by the end of the week this week. So with that, we want to thank our presenters, Dr. Scott and Tam Lutz. And for Hannah Swartz, who's been very patient with her chat problems going on. Thank you for handling that and moderating that. And with that, we'll give everybody back a minute or two of their time and wish everybody a wonderful end of the week.
Thank you. Thank you.